If you thought about facial rejuvenation surgery, specifically facelift, I'm sure you've come across the term deep plane facelift while doing your research. But what exactly is a deep plane facelift, and how does it compare to other types of deep plane facelift? Hi, I'm Dr. Sean Delaney, board certified facial plastic surgeon in Houston, Texas. And let me explain further. Now, before we talk about what a deep plane facelift is, it's important to understand what parts of the face a facelift typically treats. While it's called a facelift, it really is a lower face and neck lift. When we perform facelifts, most of the work is actually done on the layer deep to the skin. If you think of the face as like a layered cake, there's 5 layers that we operate in. The first layer is skin, the second layer is subcutaneous tissue, the third layer is the SMAS, which is the superficial muscular aponeurotic system, and this is a thick fibrous layer that contains a lot of the muscles of expression as well, allow us to move our face. Underneath the SMAS layer then is a loose areolar plane that's relatively avascular, and that's important. We'll talk about it in a bit. And then you have the deeper structures such as the parotid-masseteric fascia, and then everything deep to that. When performing a facelift surgeon operates within these 5 planes. The SMAS layer is the layer that we actually exert the pull on because it's a lot tougher and it's a lot sturdier than the skin. So original early facelift surgeons only pulled on the skin, and they found that the results were fairly short-lived because the skin can stretch over time. The SMAS layer is a lot stronger, so if you lift and resuspend the SMAS layer, it's going to give you much longer lasting results. Now, with a traditional facelift, what you're doing is you're going underneath the skin, you're in that subcutaneous plane. And you're working basically on top of that third plane, the SMAS plane. And what oftentimes doctors will do is they'll dissect the tissue out as far as they feel comfortable doing. Because a lot of that skin's elevated, you're going to get swelling, you're going to get bruising in that area potentially. And then they'll take the SMAS layer and fold it up on itself, and that's called the SMAS plication. Or they will cut out a strip of the SMAS and then suture the cut ends together. Okay, so now in a deep plane facelift, what's happening is the cut is made through the SMAS, and the surgeon now goes underneath the SMAS layer and works in that relatively avascular plane that's just deep to the SMAS, and that allows us to get all the way out here, so then we can lift a nice thick composite flap, composite being skin, subcutaneous tissue, and SMAS, up and back, so you have a more robust, much sturdier flap that has better blood supply. Now, there's a key difference between a deep plane facelift and a conventional facelift in that with a deep plane facelift, you're able to release some of the facial retaining ligaments. And this is an important concept. Facial retaining ligaments are ligaments that go from deep, that attaches to the skin. So up here, it attaches to the bone to the skin. Down here, it's deeper, more like the parotid-masseteric fascia to the skin. And so these ligaments help hold the face in place. So even as we age, the skin's not going to fall off your face. But when you're performing facial rejuvenation surgery, when you're trying to pull things up now, those ligaments will get in the way and will prevent you from getting as good of a result as you can if you don't release them. So with a deep plane facelift, we have the ability to go on and release these ligaments, which allows us to better lift and redrape the facial tissues. Now, with more conventional surgeries, you don't have the ability to access and release those ligaments to allow the SMAS to slide up with less tension. So you do have to rely on pulling on the SMAS a little bit harder, multiple sutures, to really help hold and fix things in place. And so this has direct implications for the results where you potentially could have a little bit tighter, more of a quote-unquote pulled appearance. And also there may be a little bit more tension on the incision, which can result in slight widening or more visibility of the scar. It's important to note, though, that the deep plane facelift technique is simply a tool. So a tool in the hands of 2 different surgeons may yield very different results. So you shouldn't be enamored with just that term. You shouldn't be fixated, oh, I definitely need deep plane facelift. Really, you should look and research all the surgeons, make sure you like them, make sure you trust them. And then more importantly, look at their before and afters, make sure that their results are what you're looking for. So it's more important to go with results rather than